How much thought do you put into crafting the ultimate patient care experience? Right from the beginning, before I even started my private practice, I knew a handful of items that I wanted to change about the way physical therapy services were delivered. I had been working in an outpatient satellite clinic that was hospital owned, but it was located inside a YMCA. I would see clients trying to schedule and see the friction involved in getting an appointment. I would see the frustration on the individual's face when they came in for their first evaluation and they had a pile of paperwork to fill out. All of these things would drive me crazy, and I realized that when I created my own business, these were points that could improve the patient care experience without ever touching on what was done clinically. So in this video, I'm going to go through 3 of my most important components of the patient care experience. And I want you to think of this as a way to improve your delivery of the patient care experience. So for me, number 1, I could not stand the amount of friction that I saw happening at the point of scheduling the initial evaluation. When a new client would call to get on the schedule, the administrative person handling the call would go through all of these questions. They would not allow the patient to schedule until they had all of their demographic information, all of their insurance information, until they had information about the referring physician and the condition being treated. It was almost a 10 or 12 minute process just to get on the schedule. That is a huge amount of friction. So I vowed that when the patient first makes contact with my clinic, and our system, to share the actual system level that we've used, is when we hear the phone ring at the clinic, the first thing that we do is we look at the caller ID. And if the name on the caller ID is not recognizable as an existing patient or an insurance company, we immediately go into action assuming the person on the other end of that phone is a new patient calling to schedule. So we have the admission process ready at hand. It's within arm's reach. We use a paper system that allows us to just grab the form to get the information that we need. And the first priority when we answer the phone is to book the appointment. We will collect all of the rest of the information whenever we can, but the first priority is, hello, thank you for calling Total Therapy Solutions. My name's Tony Maritato. How can I help you today? The patient typically will say, in fact, I just did this today. Hi, my name is Sally, and I have a prescription for my doctor to start physical therapy. That's great, Sally. I'm happy to help you. When would you like to start? We have openings available this afternoon or tomorrow morning. Instantly, we lay the groundwork. We don't worry about payment. We don't worry about cost. We don't worry about conversations about anything else. The first thing is, no problem, let's get you scheduled. You called to schedule, let's get you scheduled. And then once we have that person, and notice the narrative of, I have appointments later today or tomorrow morning. That's an important component of this conversation, because I don't want a new patient waiting a week, 2 weeks, 3 weeks to get on the schedule. Even if I, as the scheduler, have to rearrange existing appointments to make room for a new appointment with a new person is going to take priority over an existing scheduled appointment for somebody who's been coming for a while. And if you don't have the flexibility in your schedule to do that, obviously you use your own business systems to make whatever works for you. But at my practice, to me, the most important thing is helping a new patient get on the schedule as soon as possible. So we prioritize speed. One of our stats for performance is how long does it take to get a patient in for an evaluation from the first point of contact. We shoot for 24 hours. 48 hours is acceptable. 24 hours is beating expectations. Longer than 48 hours needs improvement. We need to figure out a system that's going to work. Why don't we have people on the schedule within 24 hours from calling from the eval? That is number 1. Number 2, I never want somebody to question the financial impact of their therapy or their plan of care. So we make a guarantee to every single person that comes into our clinic. We guarantee you will never pay more than the estimate we give you before the initial evaluation. If it turns out that you owe us less than we collect, we'll instantly refund you the difference. If it turns out you owe us more than we collect, we will not charge you the difference because we have taken the time to contact the insurance company to review the coverage, to do everything in our power to make sure that worst case scenario, we know the maximum cost to you. We hope that it's less. We will refund you if it's less, but we take the guarantee to make sure that it will absolutely not be more, so that when a patient comes to therapy at our facility, they have the peace of mind to know no matter what I'm paying, it's not going to be more than this. And I believe that that goes a huge way in helping to reduce patients who don't finish their plans of care, because patients carry with them this fear, this anxiety of, what is this costing me? How do I know what it's going to be? What if the insurance comes back and denies it? What do I do then? I want to wipe that fear off the face of the earth, out of their mind, and I do that simply saying at the beginning, before the onset of therapy, this is the maximum it could possibly cost you. This is what we will collect at the time of service. If the insurance reimburses more than we expect, we will refund you the difference, but absolutely it will not cost more than this. So my third component of focusing on the patient care experience is in accessibility, right? So I don't want patients to feel like, well, what happens if I have to cancel? What happens if I have to reschedule? What happens, I've got other commitments in my life. So my promise to the patient is, we don't have a cancellation fee. We don't have a punishment. We do ask that you notify us within 24 hours, but we understand that things come up. So if you can't make an appointment, we hope that you let us know. But even if you don't worry about it. We have systems in place so that we will not penalize you for missed appointments. And basically what we've done is we've created redundancy in our schedule, and we've increased capacity so that if my 9 o'clock patient doesn't show up or calls to cancel at the last minute, I've got a system in place to either fill that spot with another patient that's scheduled sometime later, or have access to people that are already in the clinic. Now, of course, you guys know me. If I have an opening on my schedule, I'm going to fill it with making video content just like this, so that I still have monetization strategies that will turn unused minutes of time into income for the business. But if you don't have that, if you don't craft that, if you don't take the time to find those other ways to monetize the resources you have available, then obviously you set yourself up for failure, right? Who wants to miss an appointment and then get a fee tacked on to my next claim? That's not a positive patient experience. And I can tell you that I've treated more patients than I can count that stopped going to other therapy providers because they were racking up cancellation fees for what they believed were things that were outside of their control. They said, you know what, I'm done, I'm not going to you. They come to me and we have a great outcome. So I would tell you that working on crafting the ultimate patient care experience is more important than just about anything else. And beyond this video, think about it. Think about when you go to Starbucks, right? Why does somebody pay $5 a cup of coffee at Starbucks when they can make it at home for 20 cents? It's the experience that Starbucks delivers. It's the sights, the sounds, the smells, the feel of the environment, the culture of the business. Think about the difference between buying a book at Barnes & Noble, if you remember Barnes & Noble, versus buying a book on Amazon. Right? Buying a book on Amazon is about saving money, about getting the book in a day or two. But buying a book at Barnes & Noble is an experience. You go there, you look, you touch, you feel the books, you feel the paper. You're in an environment that's conducive to just relaxing. The music, the smells. Barnes & Noble, when I used to go, always had like a little coffee shop in there with fresh baked goods. That experience is more powerful than the actual book you are buying. You are willing to pay more to get that experience than just buying the book on Amazon. And so think about how you can bring those components into your business model, whether you're a mobile therapist or you're a brick and mortar clinic owner. how can you improve the patient care experience beyond just being a better clinician, beyond just knowing more, learning more, and then how can you systematize that? That is the next component that we need to discuss, is how you take what is a better patient care experience, systematize it so it can be scaled far beyond what you're capable of doing as a single owner operator. Guys, I hope this was helpful. Let me know in the comments below. I'll catch you on the next video.